Hello and welcome back. We're glad you're here. This is Ridgeview's podcast where we try to cover everything hope, healing, and recovery related. As always, I'd like to draw your attention to our COVID helpline. We'll provide this at the end of the broadcast as well in the event that you are listening. It is 833-503-0348. It is 8 a.m. to 8 p.m. Monday through Sunday. Yes, Sunday included. So if you or someone you know is having a hard time dealing with the impact of COVID, give us a call. We've got trained counselors available that can chat with you about connecting you to the right resources that may help you best. My guest today, this is Sabrina Flettrich. This is so cool. It's very cool because you are the first guest from outside Ridgeview. So I'm super delighted that you're here. So one of the things that we were going to talk about today is substance use disorder and how that has amplified or impacted people during the pandemic. Mm-hmm. So first, tell us a little bit about you, where you work, and how long you've been there.
Okay. My name is Sabrina Flettrich. I work at Hope of East Tennessee. I've been there since November of last year. I've worked at several facilities before that. And I teach IOP. So I teach IOP Monday through Friday. There's a 9 to 12 group and a 5:30 to 8:30 group, and I do the evening groups.
Now, we try to very humanize our conversations, and so I know what IOP means, but explain what IOP is for our listeners.
Okay, so IOP is intensive outpatient treatment. So people go into residential treatment first. Usually it's a 28-day program. And when they come out, it's kind of a transitional class is what they do. And it's, just a 3-hour class. We're doing it on Zoom right now. It's usually a group.
Great. So we've been covering over the several weeks that we've been doing this, just how difficult the pandemic has been for people. What are you seeing in the folks that you're serving, caring for, treating, and what role does substance use play in their coping with the world today?
So since COVID started, we didn't anticipate this, but it's gotten a lot worse as far as substance use. Because isolation is really, really bad for anybody trying to fight addiction or be in recovery. We need connection. So the opposite of addiction, we say, is connection, which was completely severed when COVID started. So we had to get creative. And we started doing Zoom, NA meetings, AA meetings, things like that. But it still wasn't enough. The isolation was really hard on people. We lost a lot of people last year through it. Also, with the stimulus money, indirectly, hurts them as well because they get that big chunk of money, and what they do with it. So.
What are you? That's an interesting point that I had not considered. What the unfortunate circumstances that could lead to getting a big chunk of money at one time. Mm-hmm. So, have you noticed a change in the type of drug used, misused, abused? What's the most popular drug of choice nowadays?
So lately it's heroin and fentanyl because it's cheaper than other opiates or pain pills that people used to use, and it's deadly. Also, alcohol is being abused more and more because people were isolating and drinking, and then that started to be every day, and that day turned to, all day and turned into a problem.
I imagine, you're clearly called to this field for a reason. It's part of your own service identity, and you're in the healthcare profession, it must be hard to see so many people struggle with their recovery. What has that been like?
Um, well, we always say we're fighting a losing battle, but somebody has to do it. Um, and the few that do come through, are worth it. So we just do what we can, plant the seed with everybody and, work with them as best we can.
Planting seeds.
Mm-hmm.
Yeah, that's a nice way of putting it. You mentioned loss and fatal loss. A couple of weeks ago, there was a gentleman who, at one point, Ridgeview Services had been involved in his life, and I think also in Hope of East Tennessee's life. And he recently passed due to an overdose. And it was a Saturday, a rainy, drizzly Saturday, and a group of his supporters, friends, allies in the recovery community gathered out at our pavilion uh, to celebrate his life, to be with each other, to connect, and to talk about the sorrow and the loss. Uh, I was struck by the presence of other staff people that were also there to join in that remembrance. But gosh, what a heartache and a hardship to deal with. So I can't help but think of that collateral effect on those in recovery that are always going through this grieving loss process.
Mm-hmm.
How are you guys helping people with that?
Yeah, I mean, it's part of it. It's part of being in recovery. I myself, I'm in recovery almost 6 years now. And, I don't want to say you get used to it, but it's part of being in the network. Um, and it's something that we have to deal with. So we have to touch on grief a lot in our groups and in our classes and our meetings because it's a huge part of it, sadly.
Yeah, my my heart certainly goes out to folks that are living in that space all the time. So I applaud the work that you do. Um, what gives you hope about the future?
What gives me hope about the future is that there's so many of us. There's more of us actually. Outside of media and everything else, what I see in person, what I see right in front of me, my reality, uh, I see people helping each other, loving one another, supporting one another. That's what I see. So that, that's what's around me all the time. And that gives me hope.
Well, that what you just said. I mean, it's beautifully said, but it makes me think of those seeds that you referenced.
Mm-hmm.
That you guys are constantly planters of these hopeful seeds,
Mm-hmm.
not only for people who are maybe just beginning their recovery process, but who may be years down the road.
Absolutely.
Yeah, no, that's great. Uh, if you had I'm always curious about like pearls of advice because I need them myself. So, if for someone who is wrestling, maybe they're in deep with their addiction and uh, they're looking for a pearl of advice. What do you tell folks who may be at that stage of change where they're like they know they need help? Uh, what sort of message do you have for them, or what kind of pearl of advice do you have?
Well, that we've been there, and we know what it's like on the other side. So we just like to help people over that hump, and get through to go to the other side, where that you can be, happy and have a quality of life without using drugs or alcohol.
How do you typically see that go? Like when people decide to act on, you've convinced me, Sabrina, now is an opportunity for me to reclaim my life. And then I have a setback. Walk me through that process. How does that typically work for folks?
As far as coming in wanting to get better and recover, what we usually do it's based on the individual, and I guess where they would be a best fit. Um, we usually find them residential treatment normally. For us, we have a residential men's house, and it's a 90-day program, and it's a really, really good program. It's not as strict as a 28-day rehabilitation center, but it's 24-hour counseling, 24-hour support, and the network is a huge help. It's who you're around, and it's a whole lot easier to get clean around people that are doing the same thing than it is by yourself.
And this is all men?
Yeah.
Do you also have a women's?
Yes.
Okay.
Mm-hmm.
All right.
We have a women's house too.
And it's all the services are here in Oak Ridge, right? You don't. There's not another location in another community.
No.
Okay.
Everything's here.
Yeah. Well, you guys you're doing great work. I think I shared with you on the phone. It finally dawned on me where you guys are located, and I ride my bicycle by it at least once a week. So it's good to know where you are. I mentioned curiosity earlier. You are a healthcare provider, so I'm always interested in knowing how do you take care of yourself. So, what does Sabrina do to keep a positive outlook, to maintain the gains in her own life, and continue her own recovery journey?
And I think about that like self-care, and that's been kind of a theme lately. And I think finding gratitude in everything that I do is my, perspective. I see self-care as, getting to do the things that I do. Like I get to go to work and work with people that have a substance abuse problem. I get to raise my kids. I get to clean my house, stuff like that. As far as, personal self-care, I do a lot of meditation and a lot of grounding work.
You mentioned a word that has popped up a lot on this podcast, and that is gratitude. And what a kind of a lost art or discipline that is just being able to find and be in touch with even moments of gratitude. So I'm pleased to hear you say that, but I'm not surprised to hear you say that. That's great. Is there anything you would like to get out to our listeners about Hope of East Tennessee? If someone was interested in making a referral, or how do I access Hope of East Tennessee? What would that process look like?
Okay. Well, we have a website. It's hopeofet.org, and all the information is on there. Also, we take self-referrals. If people are on probation and need IOP, we work with that. We work with DCS. We take grants, and we also take TennCare and Blue Cross Blue Shield. As far as the houses go, we don't require a deposit, which is really rare. The first 2 weeks are grant funded, and then after that, rent starts, but we don't require any deposit for either house.
Well, this conversation has given me a lot of hope. I'm so pleased to hear that you guys are doing what you do and do it well here in this community. Certainly many people are benefiting from it, even though it is a hard journey. So, Sabrina, thank you for coming in.
Thank you for having me.
Yeah, it's been a pleasure. Remember, you're the first. So make sure you subscribe to the podcast, like it, and comment on listening to yourself. That'll be fun. Well, folks, we appreciate you for tuning in as well. Thank you for joining us. We hope you learned something about another agency here in the Anderson County community that's a great resource for folks that are looking to reclaim their life and deal with substance use disorders. We hope you'll join us again next week. Don't forget to subscribe, ring the bell as I've been told, and one more time, our helpline number, 833-503-0348. And we look forward to seeing you next week. Take care.